We are here today at the annual meeting of the EBMT, European Society for Blood and Marrow Transplantation. This 2017 meeting is really amazing. We have record number of participants, a record number of educational sessions, satellite sympo, media expert, how I do sessions. So it's really amazing. So today during the satellite symposia sessions, actually we have 3 or 4 symposia which tackled some of the hottest topics in the field of myeloma. How do transplant should be considered at the era of novel agents before but also after transplant? And I think very impressive and even unpublished data was reported today. For example, the value of deep negative minimal residual disease has been highlighted. It looks like that those patients capable of achieving a deep MRD negativity like 10 minus to the 6 are going to enjoy long-term survival. We also discussed some novel induction regimens, replacing the first generation proteasome inhibitors with second generation like carfilzomib. Of course, maintenance therapy consolidation has been discussed. Because we are in a transplant meeting, there was some focus on the role of double auto transplant, which has been recently rejuvenated thanks to the EMN study, especially when it comes to patients from the high-risk cytogenetics. That was the myeloma part. We had sessions related to ALL, for example, latest advances in ALL, especially the novel biclonal, antibodies like blinatumomab. We have also wonderful data related to the value of inotuzumab. So clearly, the natural history of acute lymphoblastic leukemia is being modified thanks to the advent of these novel therapies. Of course, supportive care is very important, and there were a lot of sessions around novel antifungal drugs, but also CMV management. I was pleased to see renewed interest in cellular therapy to tackle these viruses. So I think the field is moving rapidly. It's not anymore the story of transplant versus no transplant. Actually now the whole community is convinced that if you want to improve patient outcome, you clearly want to join forces between the novel agent and transplant, and it's becoming like a full treatment package from diagnosis until hopefully cure for all patients.